So if you're having low back soreness or stiffness or achiness and pain with prolonged standing, you're probably having lower cross syndrome. So lower cross syndrome is weakness of the hamstrings and glutes and tension of the quadriceps and psoas such that it creates an anterior pelvic tilt which jams the facet joints in back. There's these two joints in back that get kind of pushed together and compressed. So you can see with a hyperlordosis or an increase in the curve of the low back, it can just jam those structures back there. So one of the many things we do is to try to get you into a more neutral position like this. But initially what brings people in is these muscles are jammed up and tight. They feel this achiness with prolonged standing and typically a hyperlordotic position of their spine. In order to properly assess you for lower cross syndrome, what we want to do is take you through some range of motion. Now, typically, your range of motion isn't necessarily restricted with upper cross syndrome, but what you would typically have is when we bend you back, that'll cause more intense pain. And during your McKenzie evaluation, what we typically find is that the more back bending you do, the worse you feel. So we would call that a facet syndrome, but caused by lower cross syndrome. So we would also do some neuro testing just to make sure there's nothing more severe going on. And so with the range of motion, McKenzie, and neurological testing, we have a pretty good idea of what's causing your pain and can develop a diagnosis and treatment plan based on that. Some of the things we will do in the office to treat this condition, treat your lower cross syndrome, is to loosen up the muscles of the back. So we would do deep tissue massage, active release technique, or fascial distortion model, some of the more advanced techniques to quickly loosen up muscles. Also, we would do show you some home exercise where you can stretch the muscles that are tight and strengthen the muscles that are weak so that you can help to rebalance the pelvis and get it set in a position where it doesn't cause the jamming of those joints in your back. So we use a mix of different modalities, chiropractic adjusting, soft tissue work, so massage therapy, and physical therapy type exercises, all to get you out of pain as soon as possible and get you back to your life as soon as we can. If you'd like help feeling better with prolonged standing and decreasing your overall back pain and decreasing that soreness, give us a call. We'd love to help.